Are you guys all doing well on this fine, very cold Monday? Yeah, I can tell by the silent nods from basically two people who I can visually see. So thanks. Makes me feel a little less alone. Appreciate it. Oh, how do I change it so I have things? Okay, well, you're just gonna see my mouse. It's the 25th and this is the first meeting. So I thought, oh, if you don't know me, I'm Kate and I'm the president of the club. So I thought that a really good way to start off the meeting for EMS Club, which, sorry, we're just going to jump in there because I realized I double booked myself, so I have to get back to another thing. But if you guys have questions, like seriously, feel free to pop in. I have time for you guys, obviously. So I thought we could go through a timeline of kind of where the club is versus where it could go, because I feel like there's a lot of confusion, and being me and my tentative last semester here, I guess we'll see. I think it's really important that we're all kind of on the same page. Obviously, this is not where you have to go if you and the club for future members want to take off from. There are so many potential paths, but this is just where, when I had started the club, where I was thinking that we were going to head. So November 2019, the club was created, yay, and we had an email address, and that was the most exciting part of my month. Then we have phase one, which is get people into the EMT courses and try to get like a really steady kind of line of people going to get their EMT course and their certification, get our members CPR and AED certified, and develop a strong fundraising program, because obviously EMT courses can be very, very pricey, and not all of us have money because we're poor and we have college and food that we'd rather pay for than extra work. So trying to develop a strong fundraising program and everything. We have our phase two, which is to work with the school to start developing the actual collegiate portion of EMS and taking over some medical like situations, such as the EMS presence at sporting events. A lot of the other schools like Duke and CU and basically any other collegiate EMS club that starts to become well established at the school has made their presence on the school where they actually can handle the emergency medical service cases. So I think that probably a really good way would be for us to start taking over some of the EMS, like persuading the school and the athletic department to maybe start letting us take over some of the EMS presence at sporting events, since you always have to have an ambulance there for concussions and hopefully nothing more than that. So, and then phase three is to connect with Rapid or wherever the future club wants. These are just arbitrary phases I made last night at like 11 p.m. because I was like, this looks nice. So obviously, again, you don't have to follow that. But I know that once you start getting into the really big colleges and the EMS collegiate clubs, they started to branch out not only in helping out with their schools' medical support, but also within helping the community. So like Duke has one where you can volunteer them out, and then that's a really good way to kind of bond the school with also the local like community there, and to also help with some fundraising because they accept donations, and it helps with getting some money for the club. CU has pretty much completely left from serving the campus down in Boulder, Colorado, and they're only serving the community. So those are just some future aspects that you could go with. Obviously, wherever you guys want to go with the club, that's wherever. Obviously, we are right here, which is getting people into EMT courses and getting people CPR and AED certified, and then getting the money from people, but in a kinder way than what I just said now, because obviously people don't like it when you just tell me, give me your money. So this semester, okay, do you guys have any questions? Sorry, I'll backtrack a little bit. Do you have any questions about that? Does that kind of make
Are you trying to get the members EMT certified or like fundraising for other people who can't afford it?
members? Definitely members. You guys are my priority to get money to you. That's why we have so many Pancheros fundraisers. Like, now that you guys are all here, I know the names who I can just decide to volunteer and sign up your emails for, because right now I've been making up email addresses, which I mean, luckily Pancheros doesn't check, so, but you guys don't know that I make them up, but I like definitely have registered my Rabbit and then just put at mines.sdsmt.edu as email address for a person. They haven't said a word, so we're just not going to tell them. But that's why we have so many fundraisers every 2 weeks, and I try to keep them setting up. So far, we've raised almost $1,000. It's like a really steady way to get money, but not the fastest way. So obviously, I really would like us to think of some ways in which we could do it. Taylor and I are working on crowd raising platform so that we can put it out to the Mines alumni to see if maybe they'll be able to donate some money to you guys. And then I've applied to some really, really random grants like Black Hills Energy. Not that them having thought that they, sorry, that was a bad sentence. Not that energy has anything to do really with us, but I'm totally fine twisting things into sounding like we're very important. And why wouldn't you want an EMT in the energy work? Because what if you get electrocuted? Therefore, EMS personnel would be very beneficial to helping your survival or whatnot, you know. But yeah, it's definitely members. Sorry, that was a really long-winded way to say that. Yes, members getting EMT course, members getting CPR and AED certified with the American Heart Association. I know that in Rapid City, especially if you do it through Western Dakota Tech, your EMT course, they give you a CPR AED program, which is very different than how I did it because I had to go find my own. But obviously, since not everyone can do that this semester, because EMT is about another like 300 hours, I think, or maybe it's 120. I honestly can't remember. That was a long time ago. It's either 120 or 300 hours, but either way, it's meeting basically twice a week for at least 3 hours each time with 8-hour days of like some like full doing clinical practice on each other. So obviously that's a lot of time. And if you're in school, maybe you don't have that time. So I thought another good way would be the CPR AD. And plus that way, if someone, I don't know, keels over in front of you, at least you know how to call 911 and then breathe into their mouths. Also work the machine of AED. AEDs are really nice because, as my instructor told me, they're made for stupid people. So all you have to do is follow the instructions. So you'll basically get certified in knowing how to educationally follow instructions that yell at you a lot. So hopefully we'll get one of those. A person coming in, I've been working with the risk reduction people at Mines, and they said they have someone. So these are meetings this semester. However, I realize that some people can't do tonight, and because I'd really like to get the most optimal, we may be moving to Tuesdays at 6:30 p.m. rather than Mondays at 7 p.m. Does that seem Gucci? From what I saw, I think that impacts maybe one person here at this meeting, but does that work for everyone else?
Yeah, that's perfect.
Oh, thanks, Taylor. You're perfect. Okay, you should record these. Okay, actually, I guess don't record these ones because these are wrong. Don't look at that. Okay, but the theme this semester is language and communication in healthcare and why it's important. If I could do a rainbow, I would do that. But here's my meme I could find because my only knowledge stems from SpongeBob memes, although I've never actually seen SpongeBob. So Family Feud Man says, name a reason why you might learn a language. Does anyone want to take a gander? If I knew how to add music in, I would add music, but I've never actually watched them.
Speak that language.
What, Taylor?
You learn a language to speak that language, to communicate even.
That's super correct. I mean, that's like basically encompassing. That's okay. You don't have to think of them because I thought of them for you last night. So obviously, knowing another language creates a more genuine interaction with our patients. Being able to, like, I don't know if you guys think about if you were in a different country and for some reason keeled over and went to a hospital and you had a bunch of people screaming at you in a different language. It's a little bit nerve-wracking. Not that I've experienced that either, but I can imagine it'd be nerve-wracking. So, you know, I think it's always nice to have someone who can at least say, hello, my name is so-and-so. You probably won't die. Or something like that. Or do you need help? What's your name? Give me your wallet, but like not in the sense of like stealing, but so that you can like get their driver's license and report them to an ambulance. So it places patient safety first because it kind of helps if you know what someone's saying, if they're being like, I'm allergic to insulin or something like that, and then you were for some reason about to give them insulin or an EpiPen, then you don't do that because you would know. So obviously that's one way in which you can put patient safety first, but there are about a bajillion other ways because if you can interact with your patient more directly, you can get them like to medical care in a more timely fashion. You reduce the amount of miscommunications between you two. So obviously there's lots of ideas, and I would be a very long time for me to sit here and list them all off. It develops more inclusive professionals. That seems like a no-brainer. Reduces medication complications just because you can help people, or you can work with your patients to make sure you guys are both kind of on the same level. A lot of, I think it's like 2 out of every 3 medication miscommunications between language barriers results in a like 911 or emergency call. So obviously reducing that is more beneficial to your patient. Language can be insight into culture. Culture obviously plays a really important part into how people pursue their medical care and what they value within their medical care. And I think there's only like so much culture you can understand if you don't also sometimes understand the language that comes into it, because oftentimes that can be a really important aspect. Lowers the overall cost of healthcare. Normally what you have to do is you have to hire these translators to either come in or talk through an iPad. So you don't have to pay them because you know it. You're basically an all-in-one doctor, and that makes you 10 times better. And also makes you more competitive advantage, whether you're going into healthcare or if you're going to any other sort of job. Reduced misunderstandings, I already said that, infinite other reasons. And now you got 92 out of however many points you could have gotten. So does that seem interesting? Yes? Are you guys interested in that? We don't have to do language if you don't want. We can brainstorm other ideas. That's just what I was thinking over last Christmas break. I thought it would be super interesting and intriguing. Gucci, yes? Take your silent nods as yes. All right. So this semester, this is a very, very large slide, so I'm very sorry to kill you with this. Hopefully we'll have the LGBTQ health and EMS. We're gonna have that being a PA from, I think, New Hampshire or something like that. She's over somewhere on the East Coast. She's super nice. She was gonna come in last fall, but then because of COVID and everything, not that she was gonna come in, but like she was gonna Zoom in the fall. But because of COVID, she had a schedule change and had to pick up some extra shifts, so she couldn't. But hopefully we'll still get her probably early February. Therapeutic communications and trauma, February 16th, because if we transfer to Tuesdays, it'll be a day later than this, so ignore all these dates now. But that will be taught by an SDSU nurse who's just about to come into her graduation and going into her years. So she reached out and thought that that would be really cool to talk about that. And I said, heck yeah, because that'd be cool. And also she's my best friend. So obviously I had to say yes. Spanish in healthcare, that is with an EMT who is over at Western Dakota Tech who speaks Spanish. We need to send him 3 dates that work in March or April. It's not that we have to have him come on 3 days. We're just giving him the flexibility of choosing between 3 different days. So if our meetings are no longer Monday, ignore this one. So Tuesdays would be March 16th, 30th, and 13th, or we could do Saturdays, which is March 20th, 27th. Apparently we have multiple, and April 10th. Do you guys have a preference for Tuesdays or Saturdays? Or we could try different days if you want, like Fridays at 2 p.m., but then that's just a lot of changing meeting times, and I know that can be really confusing if you aren't consistent. What are your guys' thoughts?
I would try to keep it consistent with the meeting times.
Okay. So I will send him then the Tuesdays, March 16th, 30th, or April 13th, and send him those. He's also looking for people who are interested in testing his sim training that he's working on. So if you are interested, you should let me know. He was kind of going in a little quid pro quo sort of area where he helps us and we help him. So that would be a really nice way for us to give back. I think from what it sounds like, it's not that you're going to be trained to be like the sim simulator, but he had reorganized this curriculum in order to train it. So he's trying to find people. If you are interested, just email me or something. Also, ALS in healthcare, she was super excited. She is also from Western Dakota Tech. Apparently, we're just stealing all of their instructors. She's really nice, and she asked us how many sessions we want. I believe we have about 2 to 3 days open because obviously we have a total of 6 meetings scheduled because since they're bi-weekly. So we have, I think, 2 to 3 sessions are open. Are you guys interested in learning some American Sign Language? I accidentally typed it because I'm illiterate in the email and typed ALS, which is not the same thing as ASL, even if it looks the same. Does that seem like kind of fun to you guys to learn ASL in healthcare? Yes?
I'm very, very interested in the ASL in healthcare. I think that would be
Okay.
absolutely amazing.
Okay, sounds good. Obviously, I don't expect you guys, like, with having all this, like, dip into languages, I don't expect you guys to become magically fluent in a semester. That is very hard, and that's a lot of work. It just might be nice to just know a couple of phrases to be able to communicate. And I don't know, maybe it might jumpstart some lifelong journey or something to doing that. So, not to be weirdly savvy. CPR AED certification, I'm working on that. That will probably be on a Saturday because CPR and AED certifications normally are not just an hour, but like a couple hours. So I think my hope is to do that in March because maybe we could do it outside or something when it's not sad and cold. And then also because maybe somehow COVID will be less of an issue then. But hopefully you guys are all interested in that. I'm working to see if maybe we can get you guys registered then also with AHA, and then you guys can at least have that on your resume. And then, like I said, someone keels over, you know how to help and push on their chest, I guess, to put that really lax. The last one is possibly Lakota in healthcare as well. I feel like Native Americans are one of the most underserved communities within, like, you know, South Dakota, and having that is a really obvious language barrier, and it's also really pertinent to where we are, since we have a couple of Lakota tribes, I believe, around here. So I'm working on trying to find that. Is that still something you guys would want me to pursue, or should we just drop it and we'll just focus on Spanish or ASL? Logan, that was an or question. You can't just do a thumbs up.
No, I think it's a good idea. I think we should try it.
Okay, sounds good. And of course, if any of you guys want to have any other languages or something like that, or something you want to see, just let me know. I am so happy to orient like our club meetings to what you guys would like to see and what you feel would be helpful. So yeah, Pancheros. Obviously, since it happens every 2 weeks, our next one is February 3rd. I will have more when they stop rejecting them, because right now I can only put them out like a month ahead, and since it's not February yet, I can't put out any for March. But February 3rd, bring your friends or kidnap them and get them to spend their money here because it's very nice fundraising for us. Like I said, we've already made like close to $1,000 in basically a semester. So yeah, it's a really good method. Do you guys have any questions? It was a really fast meeting. That's kind of the bulk of everything I have to say and trying to prepare for everything. Thoughts, questions, provoking insights?
Sounds very fun.
Okay, you're morally obligated to say that. So sweet. Are you guys all doing good? All look alive. I mean, I think we lost people. Bye, guys. Okay, you guys can go. Thanks for talking.